So last week we talked about our screenings and what we needed to do, the importance of those, especially in prevention of cancer and what that was all about. And this week we promised to come back together to talk about the importance and have you done that? You had 3 more months. That was September. So you had October, November, and December to line up and get things done. I did have someone reach out to me who told me after the call they went and had a colonoscopy. So that was a great thing. They got it scheduled and got that done. So that was good to hear. Something that was nicely done. So at our business, at our office, we have open enrollment in October. And don't you have Medicare and all those options to re-enlist and re-enroll? So we thought it would be a nice time to talk about how are we doing and are we doing that? Do we have questions about open enrollment? Are you connected to the right resources and people about making sure that you have adequate care? I had the conversation with mom and her caretakers about United Healthcare because United Healthcare has been in the news. People are talking about what they aren't doing and how things aren't. But the care that mother is being provided is adequate. The only hiccup in the giddy up is for one medication, they can't get 30-day supply. It's a 7-day inconvenience to go and pick up that prescription. So, but the rest of it is okay. But we have checked and looked at that. So if you go to the next slide, please, Japs. I asked everybody to come prepared in the invite that you received. And that preparation was, do you have a health app, a medical app attached to your providers? And if you do, are you using it? Are you intimidated by it? And how does it help you? I put mine on there. I have two that I must follow. One, my chart, and two, Helo. So for my primary care physician, I use Helo. And for the orthopedic surgeon group, I had to use my chart. They are attached to different health records, but they are involved in our care. I did ask and put Carol on the spot and say, Carol, share a little bit about how you use my chart. And Mary, if you don't mind, do you mind talking about how you use your my chart? I didn't call you and ask, but if you don't mind, okay? Carol?
Trying to get off speaker. Can you hear me? Can't hear me.
Yes, we can hear you well.
Oh, can you? Okay, great. Hello, everybody.
Hello.
Hi.
I'm Carol, and yes, my sister put me on the spot. She told me last night, you're going to be talking about my chart. And I was like, oh, okay. So anyway, I love my chart. I do. I was on it today, as a matter of fact. My chart gives you the opportunity to look at you can send messages to your doctors, and they respond quickly. You can also look at the visits that you've had. You can look at detailed notes where you saw your doctor, and his notes are in the system as well. You can learn what appointments you might have from time to time, because we have a tendency sometimes to forget things. And so if you forget, you can just go back to my chart and find out when that appointment is, complete with the time and the location.
Oh, that's great.
Also, my chart has the different medicines I'm sorry, I'm trying to find a place where I can speak. My chart has the different medications that you're on. If you are going to your doctor, Lisa, how long do I have? I'm sorry.
Just share whatever it is that you think is important to you is what we want.
What's important to me is to see the list of medications and to see the medications that the doctors are discontinuing and that they are continuing. It's very important if you were to go to a different doctor, you can pull up my chart when, you get there and they ask you, bring the bottles of medicine that you take. And if you're like me, you're hauling in a backpack. So you can go onto my chart, having to eliminate that backpack and pull up all of your prescription medications. I think that is exciting.
Oh, thank you, Carol. That's,
Oh,
yeah,
okay.
that's good. I may come back to you. I'm going to let Mary speak, and then I'm going to ask Cynthia and Debbie to share how providers look at the use of those apps.
Let me have one more minute. All I want to say is when I was hospitalized, my chart was my friend because when they came in and took blood every morning, I was able within that day, that morning, to go out and look and see what numbers, what parts of my blood were lacking, were low, were high. So you can keep your finger on the pulse with my chart. And that's all. I promise I'll be quiet.
Oh, don't be quiet. Go for it. Thank you for that. Yeah.
Thank you, Lisa. Everything that Carl said, and I was hoping she wasn't going to talk about that last statement that she had, because that's something that I find is so meaningful. I mean, when I was in the hospital, even going through the emergency room, and they would come in and they would draw blood, and of course, then they would have to wait until the doctor comes back. Well, within minutes almost after they drew the blood or whatever, I could pull my results up. So when the doctor comes in to talk to you, you had your questions already written out for him or her so that, she could answer it. And I tell you, my chart is my friend. It's my lifeline to my doctor, and especially my cardiologist. Of course, they will tell you, if it's an emergency, call 911. But when I call them, especially the cardiologist, I'm telling you, within an hour, somebody calls me back. It may not be the cardiologist, but the nurse practitioner or somebody will call me back. And in addition to the notes, that's really useful. And sometimes I will copy them off and put them in a folder. I love my technology, but I don't trust it 100%. So when it's something really important, like the history of something, I copy it, put it in a folder. When I go to a new doctor, I simply have those notes to share with him or her what has been done. And it even gives you, in addition to your appointments, your payments, just everything that you need to know. It is everything the doctors have, I have. And to me, it's a lifesaver.
Thank you both. I have one quick question before Cynthia and or Debbie chime in. Did it take you a while to adjust to it? Was it intimidating? Was it easy? Did anyone at the office help you sign in and get registered? Do you wish they had done that? Answer those for me.
For me, it was easy. I mean, to me, if you can do email or you can set up folders on your computer, you can set up my chart. It was very easy. But when I went to the office, they always asked if I needed any help in setting it up. But I had already set mine up, and I'm fortunate to have a grandson. If I ran into any, problems technology wise, he was there to help me. But again, I love my chart.
Thank you, Mary. How about you, Carol?
Ditto what Mary said.
Okay.
Very easy.
Can I add
Okay.
one thing to what they've just said?
Oh, hey, Gwen. Yes,
Hi,
please.
everybody.
Yeah.
Also, if you need a prescription refilled, you can also just email them, and that's one way to get it done quicker than trying to call the office, call the pharmacy, and go through all that. They will respond pretty readily and get that refill out to you based on messaging just to them. They
Oh,
respond
that's
pretty
good.
readily. Yeah.
Very nice. Cynthia, thank you, Gwen, Mary, and Carol.
Lisa, I just
Yes.
have one more quick thing to add. And this just happened at my last I went to see a nurse practitioner, and I was looking at her notes, and there was one little thing that I thought maybe should have been in the notes that she had done. So after I read the notes, and I just sent her my chart, and I said, "Oh, and by the way, we also talked about or did this little test." And she would say, "Oh, thank you. I had it in my notes, and it wasn't there." So you will know exactly what the doctor is putting in your records when you look at the my chart.
And that's excellent that you recalled and remembered and brought it back to her attention. So that's excellent. Nice. Cynthia?
Yeah, I think you all bring up some very good points. One of the things that we do as providers, if you have an x-ray or you have a CT scan, right? It automatically kind of feeds into us, and then we can call you, right? Say, oh, the results are back. Can we go over it? Should we have a telehealth visit? Would you like to come into the office? All those things are integrated into the chart. So I look at my medication list, we go over the medication list, we take it out. Now, the pharmacies, depending on which one you use, if you use CVS, it's integrated. And I can, for instance, I can just tell my pharmacist, like, it's time to get a refill. They type it up, goes right to the clinician. So things are evolving around my chart. I have my chart as well, but it's very, very simplistic. That's what I like about my chart. You can change it, you can look at it. It's real-time data, right? Which we love. When your labs come back, Quest actually uploads it into my chart. I mean, whatever provider you have. So, we can get instant, like your labs take really 24 hours, but we like to look at them and kind of wait 48 hours and then discuss them. And for example, one of my friends went for their physical and got diagnosed with aplastic anemia, right? But if he didn't go for his physical, he would have never known. He was just fatigued and tired. But I just think that this new system works. But guess what? We have people that's living longer. So, like people like my mother, who doesn't use this system, it doesn't work for her, right? She's 86 years old. She has a cell phone, but she just doesn't want to indulge in technology, right? So for us, we have to still say, the paper's better for those people who indulge in technology because, we do have people living 86, 99, 100 that unfortunately do not indulge in technology, right? And as we get older, we might not indulge in some of the newer things, but very simplistic. I love the changes. When you say that the nurse practitioner forgot, sometimes we have scribes that forget. It's not always, a nurse practitioner. We also have scribes now. The nurse practitioner is so busy seeing patients. You will go into your doctor's office and you might think that's a nurse, but that might be a scribe, right? So you want to make sure that you check over, not only that the spelling and make sure they're putting everything in your medical records correct. So kudos off to you for even checking because oftentimes we don't do that. So I really appreciate that you're checking and making sure because that follows you. That is your medical record. And if they type something in there wrong and maybe you're trying to get some insurance or something else, then that's on them.
Lisa,
Perfect.
one other thing I'd just like to add, and the thing that was left off of mine was an ultrasound or something. I didn't want to go to the next doctor and he would think I didn't get it and then get another one when I didn't need it. But if there's one disadvantage of my chart, I hate to say there's a disadvantage, but sometimes you get the information before your doctor gets it. And I will tell you, one morning at 5 o'clock in the morning, I'm just up strolling, couldn't sleep. And there were the results of a very critical test. And of course, I didn't know all the words. I just picked up the bad ones. And I stressed out until 9 o'clock when the doctor's office opened and I was on the phone. And then they calmed me down. But you do get the results sometimes before the doctor has a chance to see them.
That
That's
is
all.
true. That is true. It does come that way. And I think uh, it's nice to know the system is efficient, but it's not a good thing to have people worried and concerned like that. That's a glitch. Maybe one day that will be a simultaneous. It'll go I think I'd rather it be released automatically than rely upon busy clinicians who may not get it to you as efficiently or as timely as that is. So you know, that's how I'm thinking about it. But I wanted to say this. It's nice to have 86-year-olds, 96-year-olds that want paper, but wouldn't it be nice as an ad for us to get their My Charts and log in with our credentials so that we can follow it for them. Just a suggestion. Just a suggestion. Cynthia said I did for her mom, so that's great. That's perfect. That's a good option. Just another way to think as our generational caretaking comes into play and what we need to do for friends, for family, just some of those that we're supporting. We don't all just support our immediate family, we support others. So it would be nice to be able to provide them with that kind of assistance if we need to. So that's great. Let's go. Are there other apps other than My Chart and Hilo that people are using that we should be aware of? Okay.
There are probably other apps, but I think UVA, does UVA use My Chart? I'm not sure.
I don't know. I know VCU uses
I know
My Chart. Yeah. I'm not sure. We'll find out. But
Lisa,
yes,
I'm not sure if they're still using Cerner, but some hospitals it was Epic, and Cerner was one of the bigger but
health records.
Health records.
Yeah.
But now Cerner is decreasing, so they do have other other electronic medical records that they use. But thank God My Chart is expanding, and it's being able to you can see all of their Cerner notes and other doctors' notes that can be added into My Chart if you get permission from the patient. So all you need to do is get permission from the patient to have their records transfer into My Chart. And it can become a holistic type of interdisciplinary record where My is able to get those information automatically once you give permission, the patient
gives permission. That's great. Oh, that's great.
Okay. We're missing that big, we're military up here and down there. So we're missing Epic. That's what they use in the military, Epic and Cerner. So the VA uses, I think Cerner and the military use Epic, but they're on a whole different system.
Right.
So we can't forget about them as well.
Yeah.
So go ahead.
Hi, Lisa. Hi, everyone. Hi, how are you all? Thank you all so much for sharing. One of the pieces I just wanted to echo, it is important that we're reading what is being documented, because I had a recent insurance denial for some type of I won't say it's minor, but dental procedure. And the language that was chosen by the office to use for filing whatever the claim was not really the intent of why the procedure was done. And them being able to talk with me and we discussed it, they were able to then adjust the language and get something approved by the insurance, meaning they would pay a greater percentage. And so that is critical that we do communicate back with them when we see things or don't see things. So I thank you all for that. Yeah.
No, thank you. That's important of how you were able to link this to a claim and approval or denial. My ask of each of you is to tell at least 1 to 2 or 3 of your family members or friends how you use your app and encourage them to use it and to tell somebody. And if they're already using it, encourage them to tell somebody else to use it, because we want people to be empowered by their own health records and information. Next slide, please, Jap. All right. Preventive health. This is the storyline that was in Healthline today. That was not a coincidence, but it was a meaningful way to reflect on what we talked about last month into this month. Why is it important? And when you get this slide deck, this link is live, so you'll be able to click on it. So what we talked about last week was prevention and looking at how you can be screened for colon cancer, breast cancer, men for prostate cancer. But there were other things that we talked about for screening, right? That was our annual health exam, blood pressure, cholesterol, getting the appropriate immunizations, our wellness visits overall, those kinds of things. And we want to think about mental health. We want to be able to consider, how are we feeling? Do we know when we are anxious? Do we know when we are depressed? Do we understand all of that? For women who go through menopause, those changes that take us through those things and what it may do to our emotional status. We may want to talk about with our clinicians weight loss this time. It's all over the news, right? All these different medications that are available. Do we think we're eligible? Is it the right thing for us? Is there exercise or diet that may just work for some people? Do you know somebody who wants to quit smoking? Do you want to quit smoking? What are the things? These are all significant parts of what we want to do for prevention. The real thing is, if we can keep this on track and keep a plan of health, we may not have to be treated for 3 or 4 things. We may only have to be in treatment for one thing. You may be in treatment for no things. This is the reason that this is so important, that we come back to this day and this conversation and talk about, have you scheduled your exams? And you can also look at what insurance plans at this time cover. So when you're looking at enrollment, you may want to look at, what does insurance cover for prevention? Ask some of those questions, or do they cover some costs for some things? So this document or link will give you that type of information. I want to take a minute, though, and let Cynthia and Debbie provide anything that they would like to about the importance of getting these annual tests, scheduling them, how to think about scheduling them. And it's not just for you, it's for the others that aren't on this call and that you talk to, that you can help them with their own preventive health maintenance and scheduling.
So as a provider, one of the things that's helpful that, I tell my patients is, schedule it at a time that you're going to remember, right? And so that's normally birthdays, right? If it's your birthday, you tend to remember, okay, it's my birthday, I got to get my exam, right? The other thing we have to keep in mind is we have to look at the uninsured and the no insurance, right? So I have a chart for myself, even now, like free breast and cervical, right, exams that we can get free from each state. The CDC has it listed on their website. If you think that there's a copay and it shouldn't be, or you cannot afford to go to your physician, there are free tests out there for women for breast cancer, cervical, and colorectal now. And some on the Zero site, they even give you states that offer free PSA testing. So what we need to do to think about in age group, when we clump these things together, when do we start getting our exams, right? What do we need to get? And then who's going to pay for it? How are we going to pay for it, right? And is there resources that we can provide for our family members of how they're going to pay for it? Because I think there's several reasons.
Pause right there. Japs, advance the slide, please, because it'll take us, I think, close to what she's talking about. Go to the next slide. Next slide. Yes. That's the one, you can barely see it, but those have the ages on there. So keep talking, Cynthia. There you go.
So when we think about, even like a dental exam, we can go to the health department and we can get now free dental care, right? So as a provider, you want to also know your patient, you want to know their insurance type, and you want to provide those resources for them. But the greatest thing is, when do you go get it, right? And how? And the way I used to tell my patients is, think about your birthday. It's time to get everything done, right? Because, you're not going to miss your birthday. You're going to understand that even though October we might do our plans over, But let's say July is your birthday. Is that or something that they will remember that would jar in their head that it's time to get these exams? I'm gonna stop there and see what Debbie has to say.
Cynthia, I agree with you. A lot of times, when you're scheduling your, exams, you definitely have to look at what type of insurance is there. Is there a payment, a co-payment, for this? And can they remember? Are they writing it down? Are they putting it on the fridge? Are they whatever is going to clue them in to remind them that it's time to come back or to get it next year. So the good thing is once you have it, let's say you have your yearly screening, to make sure that you're scheduling your other, your follow-up exam. Sometimes we're like, oh, we'll do it later. But just to make sure that we have that follow-up test and that you're writing it down, or you are scheduling on a day that you're going to remember. For some patients that don't have insurance, just remember that some hospitals have free care. They have a van that would provide what they call charity care in many of the hospitals for screening, particularly colon cancer screening, breast cancer screening. And so make sure that if they don't have it, that at least we're asking them about their financial capabilities and then offering that assistance if it's available at some of the hospitals, particularly in the lower economic income areas. I know Bon Secours has it, Cynthia has it, and a lot of other hospitals have those free charity care for those patients. So it is available.
I would like Debbie and or Cynthia to send to JAPS for me the free services, because I think a service that we can do on this call is to let our communities know where those, as you have described, who are under supported by insurance, where we can get it. If you have it and can put it in the chat, that's great too. Either way, I think it's important for us to be able to share that information. Give it to your health ministries at your churches. Provide them with this type of information, so when community is seeking and looking, they have this type of resource to be available to them and the surrounding community that we support, because there's no excuse or reason. When we look at this chart, the first line starts at 20, because I don't know if you can really see it, and the last one is at 80, so that it really is a reminder of when we are to schedule these screenings and to have conversations and to talk or to do them. I think it's very, very important that we know it's to prevent things and to make sure that that's how we are taking care of our bodies.
So Lisa, on this, and I will definitely email it to you because this is really important. I looked up this data last week. Because it's a free site, they actually have to do the statistics on it. So for cervical cancer, 58% of Hispanics got their cervical screening. For Blacks, it was 10%. African Americans, 10%. For whites, it was 22%. Now, these were people that fell in either underinsured, no insurance, or they fell into poverty, right?
Okay.
And then for breast, it was 54% had their mammography versus 13% of African Americans, 25% white, 4% Asian, and 3% American Indian. Now, these are free services, free, right?
Wow.
And as you can see, who's taking advantage of this, right?
Mm-hmm.
And there's no excuse, guys, that we can't tell our community what's happening to us. And so when you look at why Black people, we're being diagnosed the same, but we're dying at a higher rate, you've got to go back to the beginning. Did you have your mammography? Now, because again, this is free, they collect this data. So
And
this was very
Cynthia,
eye-opening to me.
so Cynthia, I just want to be sure I'm clear that what this statistic is referencing is that 13% of the population that was uninsured of African Americans or Black, that's the only percentage that took advantage of it out
That's
of that
correct.
100% group.
That's correct.
Okay, I just wanted to be clear. Wow.
Yes.
That's,
I know.
we need to, yeah, we need to share that with our community and make sure that that information is out there.
And when I send you the link, you can see it on the CDC website. Like I said, this is free for all 50 states. Medicare B actually picks it up too as well. And
Okay.
Medicare B also says there's no charge for a colonoscopy now. New rule just changed with President Biden that there's no copay. So we need to spread the word that it's important to have these screenings. And we need to continue to talk about this message.
I think that's very appropriate that we can share and tell it. I mean, it's important that we do this because our circumstances in life change. We may go with a lapse of insurance for some reason, but it doesn't mean that we don't have to go without these preventive services. It isn't that you are, in an impoverished state. It's that your circumstances changed and you just may not have insurance, or you have prioritized having to do something else in life and have not picked up insurance. It's also important that we tell young adults and some youth in the 20 to 30 range who don't have insurance, they may be working contract type jobs or doing other things, that this is information where these screenings are available for them if they need them at that age range. It's very important when you think about the cancers caused by HPV and what screening is available and what you can do. So that's significant. Let's look at the next slide. And Cynthia, you can talk while we move to the next slide if there's something else that you want to say.
And I just think like, move to the next slide.
Well,
I just think like, are we really aware of the free programs? And that's why we have to go to awareness, right? Mm-hmm. And I just also want to say that the ages from 40 to 64 had the most participation in the mammographies and the pap smears. Okay. So the younger group was under 30 was like 12%, and 30 to 39 was like 20%. But again, these are things that we just need to make aware to the community. If we're in the community, share the wealth.
Got it. That's perfect. I schedule I used to do, because I love myself, I used to do it in February, but now I do it for my birthday time. And, if I have to travel, I have another excuse. I'm thankful for I'll do it around Thanksgiving. But those are usually the times of year that if I get off kilter, that I can remember that I want to get those things done for myself. I did want to ask is there a way to ensure that if we want to follow our blood work, Cynthia and Debbie, and we don't want to wait to an annual exam, is there a way that it might be covered to get blood work done every 3 months, 4 months, or something like that more regularly and consistently? Is there any, I know my physician will say, I'm going to watch this, and I get to come back more frequently, but are there just regular ways that you can do that?
If you're showing symptoms, like we know vitamin D, right, is,
okay,
you over fatigue or you're tired, you see some bruising going on, you are symptomatic, you come in, you have a cold, they might say, let me just check your WBCs, let's see what's really going on. But a normal healthy person should have great labs. Now, if your labs are abnormal, it triggers us to do it another 1 month, 2 months, it's up to the physician and it's up to their
Okay.
insurance. But if something is definitely abnormal, that she types in, you know, what's abnormal and why she needs to have you come in and see them again. Like if your WBCs is maybe 8,000, why is it 8,000, right? Or your WBCs is 26,000 or 45,000, maybe you got a leukemia. If your vitamin D is off, you're saying, I'm so tired, I can't get out of bed. Or could it be thyroid problems, right? So yes, we will do your labs more frequently, especially if you have a thyroid problem.
Okay.
And that's common in females.
So what we can look at our abnormals or our low highs or high lows or whatever you want to, however you want to say that, but make a request or ask. If I were just basically normal, I should be comfortable with coming in once a year to get things done unless something is wrong. Correct? I just want to.
You know, like you maybe your A1C is like borderline. All right, come
Okay.
back in and let's put you on some diet control, right? Let's put you on some walking. Let's cut your sugars out. I'm gonna check you, right? I'm gonna check you in about another 2 months and see how you're doing, right?
Okay.
And Debbie, that's usually what you see too as well, right?
Yeah, so you'll be followed. And if you're symptomatic, sometimes something's going on, and before the lab work could show it, you're showing some symptoms. Like Cynthia say, or if you implement a therapy, if you're treating or if you're recommending a change in diet, you know, or you give a medication and you want to see how that's working with your blood work, then they would do it a little bit more often for that. Yeah.
Okay. Well,
I'll tell you what they
go
check more
ahead,
frequently
Cynthia. Mm-hmm.
is the cholesterol. If you're on a cholesterol medicine, make sure, guys, because that cholesterol medicine has a lot of side effects. So you want to make sure you get levels. If your bones and stuff start to ache, that is definitely from your cholesterol medicine, right? You need to come off that statin, but make sure you get your levels checked. My husband had the same issue. He can't take statins at all anymore. So if I mean, they have some degree of musculoskeletal pain, but you should be able to walk. You shouldn't be feeling tired, you know. And so make sure that you get the levels drawn on those type of medication.
Oh, that's great. Great information. A great tip on those who are on statins. And I'm sure you've been told that, but it's just a good reminder. Any questions about your app, open enrollment, scheduling your annual exams and your screening? Is everybody empowered and comfortable with what we need to do so that in 2025, when we talk about our enrollment and our annual exams and where we are, everybody will feel comfortable? Just raise your hand if you know how to do that on the Zoom, or raise it so I can see you. There you go. There you go. That's great. That is perfect. I mean, that's what we want to hear. A couple of things that will be coming up. We're going to
Lisa,
talk. Yes.
Lisa, before we change over, I just have a question on how
Sure.
often we should do things. And one of the questions is, if you're on a statin, is there a rule on how often you should get your levels checked? Or you have to do it once on your annual checkup? Or if you're on statins, I remember when I started, I thought it was every 3 months, but now it's gotten to be like every 6 months or 8 months. So I feel like it should be done more frequent.
Well, the recommendation is when you first start off is the first 3 months, then they move you to 6 months. If you're not having any side effects, right? But remember, as we get older, everything is how is medicine eliminated? It's through our kidneys and our liver. And as we get older, right, it tends to slow down. And so that's why I said if you're symptomatic, it's probably already late and you should come off of statins. But you can ask your doctor, you can actually look it up. What is their recommendation? The first thing they're going to ask you, are you having symptoms? No. But you know, I was listening to this podcast and someone recommended at least get it checked once a year, right? And I feel more comfortable. The insurance will pay for that, right? And, maybe it's you're feeling fatigued. Maybe you're feeling tired. It's your body, it's your mind, it's your soul. And it's definitely covered. I can tell you that. I don't know what statin you're on, but the majority of them are old. People tend to put us on Lipitor. But the newer ones doesn't have as much. One of them now, the newer ones, you actually eliminate it through your gut, which is better because it is eliminated through your feces versus your liver, which is extremely important, or your kidneys. So it's a newer drug. It costs a little bit more. But what I always ask my doctor, what is my tier level? And I would like to try something new rather than old, right? And these, as we talk, these are questions that we can ask our physician. They're so busy, they come in, shh. And I have my questions written out, guys. Even me as a practitioner, I write my questions out. Like, stop, let me ask my questions, right? How are you feeling today? Here's my questions, doc. How much time you got?
Yeah. Cynthia, I like that. Did everybody, Mary, did you understand when
Yes.
when she said tier, what's my tier status?
Oh,
Did you understand that? Because
I'm
I
not-
think that's an important question that most of us are not aware of, that I'll let them explain. If they weren't on this call, I would explain it, but Cynthia or Debbie, if you want to explain how medications are given out based on certain plans.
Correct. So when you go to put in a prescription, as practitioners, it says, oh, the CVS will say, this is a tier 1 drug. So that means it costs you more out of pocket, right? The newer drugs versus the older drugs, right? So if I look at Lotensa, maybe cost you $2, but if I get a newer drug, which is a tier 1 drug, it's not, it's now branded, it's not, it's a newer drug, and so you have to pay more. And your doctors will look at your tier, and sometimes they'll say, no, I don't want her to pay that, right? So that's why I have my questions written out. How much would this drug cost versus that drug? Because if it's generic, it's not going to cost you much, right? And sometimes our physicians, not knowing, not harmful, but we want to make sure that it's not breaking our pocket, right? Meaning that I look at you and I say, hey, I'm going to give you that choice. I can prescribe you A, but if you can afford B, I would rather you take B. And some people say, no, I would rather take the generic, right? But make sure that they're offering you the newer treatments, right? Because I can tell you, like hydrochlorothiazide is an old drug, but it's still heavily prescribed in the Black community. But we tend not to tolerate it as much. So, just make sure, you're asking good questions. What type of drug I get? What does my insurance cover? What's the cost to me? They can tell you right there. You don't have to wait to go to CVS and get a surprise. We know how much it's going to cost you. Did I make that clear, Lisa?
Yes, that was what I was looking for. And the last portion of it was your insurance and health plan determines sometimes what tiers are available to you. And you may have to fail a drug based on a system in order to get to the next drug. But I think it's important for you to ask, as Cynthia says, be empowered to say, are you prescribing this because you have to, or is there another option that is available to me? And we have to get to that point of comfort, of not just accepting a medication because it's the first one that's given to us. Okay.
And let me provide some context behind that. A new drug will have coupons. Honestly, they do. And they will give you cards because they want to sell it. So the newer drugs, like my husband, he's on a newer drug for cholesterol. The drug would cost us $70 out of pocket. We get it for $5. These are the questions that you have to ask your physician. Is there a coupon? And normally the coupon will last for a year. By that time, the drug is consistently maybe coming down, maybe not. It's an oral, so it should come down some, right? So these are the questions that we want to ask, right? What are the newer drugs? Have they been studied? And what is the cost to me?
Do you mind
Mhm.
sharing that new drug for cholesterol, or is that unethical?
We
I
won't share that new
Yeah,
drug
yeah.
on the line.
Okay,
If
Yeah.
there's an opportunity, we'll do it offline.
got you.
Correct.
Okay. But you could use either Healthline and ask for statins in that way, or newest, you could ask for newest in a Google, which isn't a bad thing because many Googles are okay. But you could
Yes.
use Medscape and you could ask that. But we'll get out. Call me, Mary. Okay. So
And
we
Debbie, what do you have to say about that? Debbie was a nurse navigator, so she dealt with a
Yeah.
lot of medication.
So a lot of the medications, they do have some type of, sometimes they'll cover the whole, if they, the whole cost of the medication. Sometimes they have a program. And so the financial coordinator, if they do have one in your, in your hospital would help with that, to see if you're having any issues. They may have copay assistance for those drugs, particularly if they're newer. If they have a lower income and they meet a percentage of that income, they will qualify for assistance with that drug. And definitely, a lot of times there are coupons available and they have it right there. And so that is a way to get that. And like Cynthia said, definitely ask, about the newer drug, particularly if you're not tolerating the drug. Sometimes you're having side effects and you're not really telling the doctor, or, it's causing issues or concerns. And sometimes the doctor's quick and they're not asking the right questions, or you're not asking, or you're not telling them what's going on, particularly if you're having symptoms with the drug or if it's not working. Definitely look for alternatives to the medication.
Mhm. I won't stifle any other questions. So if people have questions, now is your time. It doesn't have to be related to the topic. This is our free time.
I wanted to add something, Lisa. I wasn't sure. So for colorectal cancer, and this is something because I deal with a lot in my previous life of GI cancers. 20% of colorectal cancer is found in the cecum, which is the terminal end of the colon. Many times the GI physician don't go that far when they're doing a colonoscopy. And so to advocate for yourself, make sure that you're asking your GI physician when they're doing a colonoscopy that that you want them to go as far as the cecum. And which is a sad case, but a lot of times they don't go that far. And so they're just an FYI to make sure that they're doing it. You're assuming that they're going there, but they're not.
Is there a reason that they don't?
I would say laziness. Forgive
Okay.
me, but it's the little part of the colon and they just go so far and that's it, which is sad. But
Yeah.
unfortunately, not all GI physicians go into the cecum. And so just,
So a nice, comfortable way to say that. So when you tell me my report, you will be expressing, you will be telling me the results from the tip of my colon all the way down to the cecum.
yeah, just make sure that it's done.
So that's a check me.
Check.
That is like, what you're talking about as to what it should be. So you'll be able to show me that that's the result.
Yep.
Carol, you're grinning.
I know.
There I go, huh?
That's okay. It's okay. Keep going. True advocacy at its best.
Yeah, yeah. We want you to be able to advocate and ask these questions in a way that you're comfortable, but they also recognize that you know what you're talking about, and it's a check, not a bad check, because they get busy and fast. It's not deliberate all the time. It's just people get caught in a routine, and you go, "Oh, I didn't realize I wasn't doing that." Okay, so give the benefit of the doubt that it's an honest mistake, not a deliberate mistake, or deliberate what do I want to call
Oversight.
oversight. Thank you. That's the word. Exactly. Yeah. Thank you for everything that's put in the chat. Anybody else? I'm not going to stop you. You ask your question. This is what we want. Questions asked and answered.
One question. In
Yes.
regards to the cholesterol medicine, is it any benefit in taking the CoQ10 together with the cholesterol medicine?
What do you mean benefit? The best benefit we could do for cholesterol is diet control, to be honest.
Okay, it's a supplement, the CoQ, what is it,
CoQ10.
Yeah, supplement. I have heard that it is good to take that along with the cholesterol medicine.
Gwen, I have to tell you, I'd heard that too when I went to the pharmacist at Costco, which I don't normally go to, and I was telling him I had a little itching. I said, I'm getting this, but she said, I don't know why doctors don't prescribe the CoQ10 every time they give you the cholesterol medicine, because it lessens the bad effects of it. So I didn't ask my doctor. I started doing it, but she's okay with it. She didn't say don't take it. So that was a good question.
So the side effect is what you're saying is the itching, right? Mm-hmm. So I'm not a fan of a lot of medications, right? I just tell you this right now. But if something is stopping this, if you're itching, then that could be a side effect of the medication, right? This is some of the things that we're talking about. I would go back to my physician and ask him. A lot of people do a lot of things in this world, but it might not always be right for you. I'm going to leave it like that, right? So, one of the things that my cholesterol was creeping up. So I had to, really look at what margins I'm using, what am I eating, how am I walking, what my diet control is. Shoot, you almost can't eat anything, to be honest. But, diet control is the best thing for our cholesterol, right? And I know there's a lot of things that's supposed to be natural. And Debbie, you might can talk to this. I know, but why do you think the doctor asked you, are you using natural supplements with your medication? Let us know right away. Yeah. So I'm gonna reference that question back to your physician, and he's gonna say, well, what kind of side effects are you having?
Yeah. Okay.
Yeah. So if you were not already on a medication, somebody, and it was borderline or something, somebody may for one reason say take CoQ10, as a natural supplement, but because you're already taking it, I wholeheartedly agree with Cynthia, because if I go back to what I recall in cardiovascular disease, there's studies that say it does that, and there's studies that say it doesn't reduce LDL. So I don't know the true answer to that question. I also know that it is known to do what Cynthia said, reduce side effects related to some of those medications. But the real answer is go to your physician. Now, Mary, you're going to laugh at this, and people on the line, if you work at Costco or Sam's Club, they got that great big old counter of CoQ10.
Mm-hmm.
They may be trying to sell. They may be trying to sell.
I was thinking that.
So I was so forgive me. But just forgive me for thinking that it might have just been it's not a bad thing, but it could just be a marketing suggestion.
But actually,
I thought that when she first said it.
So Cynthia provided you the science behind it
Right.
that I recall from, just cardiovascular stuff overall. I mean, there, I take CoQ10 because I don't take anything, but that's just one of those things. My doctor is like, that's fine, whatever.
okay.
But if I were on a cholesterol medication, that meant that didn't work.
Mhm.
I did check with my doctor before I bought this big old container right here.
That's a big container.
But you talked about itching.
Yeah. And
Yes,
she kept,
that's
I'm
different.
telling you, I'm one of these people that I've been through at least 8, and I'm on probably, if this last one doesn't work, she'll probably just take me off because,
Okay.
this one is working. I don't have side effects, but there are people like me. I heard somebody else say there's just not one that's going to work for you.
Yeah.
Well, that's the way my husband was too. Yeah, but
Yeah.
what I'm saying is probably the metabolism of the drug, right?
Yeah.
So again, go back and ask your doctor.
Mhm.
The newer drugs is out. That's your homework. Have we tried those?
Put it in my chart.
Yes.
Put it in my chart and say just a question. Is this
Mhm.
the latest one that I'm on? Is that the latest statin that's available? Is there another option if this does not work?
Right.
Correct.
So,
I say yes, but it might cost you a lot of money.
and
Right?
and say, let me be the one that decides
That's right.
if I can afford it.
Absolutely.
You just
Great
may
to-
not go on that cruise this year. You just wait till next year.
He's going on that cruise.
All right, my friends, this has been a lovely conversation. Thank you for joining. I learned so much when you all come together and ask the questions that you do. This will be in the archives and it will be available to share. And Japs, thank you as always for controlling all of the technology and the links and the information that goes out to everybody that is available to share. Don't forget Healthline, don't forget Everyday Health, don't forget Black Health Matters. And on this line, on the website for Breast Cancer Awareness Month, where you see my puppies that say get the puppies checked. That's what it's about. Tiger Lily Foundation is on the website for us too to check into. All right.
All right.
I'll
Thank
include
you.
those
You will.
together with the free site free prostate exams that Cynthia shared. I'll make sure to
Okay,
send that to
great.
everybody.
That is perfect. Thank you so much. And we'll see you in November. Okay.
Okay.
All right. You all take care.
Bye-bye.
Okay.
Thank you.
Bye-bye.
Bye. Thank
Thank
you.
you. Thank
Lisa,
you.
when does the date change?
In January. We go
January.
from Wednesday to Tuesday in
Gotcha.
January.
Gotcha.
Same time, different day. So people who go to church on Wednesday, do exercise on Wednesday, all those things, I think Tuesday will work nicely for many people.